for bearing with the brunt of the ophthalmologists and all the technology that they keep talking about. So rather than go into too many details, we were hoping and we had set up a fiber optic link from the clinic to the Madhuban hotel, but the quality of transmission through the microscope was not coming out to its satisfaction, so we decided to go ahead with two surgeries today evening and have recorded in detail. It will just take about 10 minutes to finish these videos, but you'll get an idea of how it is done. Some of it has already been shown, but how it has changed the way we do cataracts. As you heard Dr. Pakrasi say that patients were operated and they had to lie down for almost a month with sandbags on their sides. They were not allowed to walk around. This is like just about 50 years back. It's not very long back. And now things are that following cataract surgery, patients can even go for a jog right 5 minutes after the surgery if they want, not that we recommend it. So it's the era of laser precision and everything, and cataract patients, as you heard, now expect spectacles-free vision. Initially when we used to do cataracts, patients were, we would only think that it was accepted that glasses would have to be used, bifocal glasses, you would have to use, reading glasses and distance glasses. But now, because LASIK has made things so popular about getting freedom from glasses, so all our cataract patients expect that this is a picture, which tells you all that we started with intracapsular surgery right on top when our incisions were almost 12 millimeters in size, coming to the 7 to 8 millimeter size extracapsular surgery about 30 years back. Then we came to phaco about 20 years back, and now phaco is passe almost. We still do a lot of phaco and we do a lot of micro phaco, and laser surgery still has time before it kind of replaces. But we are down to these micro incisions, and I think it's a step. It's another step towards perfection. This is what we aim for. These are these. You will see these multiple rings inside. This is a multifocal lens inside the eye, which will allow us to have both reading and distance vision without the need for reading glasses or distance glasses. So this has these things have all made it possible. So this is the laser cataract suite, which everybody spoke about. I won't go into details, as you will compare these two pictures on the left and the right. The one on the left shows you the perfection of the laser. You will see that the capsulotomy is almost exactly perfect as just like the lenses. Here you will see this broken capsulotomy, which we typically make with the manual surgeries. Not that this is bad, but this is perfection. So perfection will always translate into some benefit to the patient. Now this is typically how, today we were going to operate, and I decided that since we cannot do live transmission, this is how a patient would walk in for surgery today. It's basically a 5-minute procedure in the laser room and a 5-minute procedure in the operating room. And as patients come now, it's a daycare procedure. The patients no longer need to be admitted for surgery. And usually they are not made to feel as if they are going to be admitted and kept in the hospital for some time, and mostly patients wait for about half an hour to 1 hour for dilatation, and after that they would be taken into the operating room when their turn comes, and usually they're out within 10 minutes and they can go home without need for any. It's a topical procedure, topical anesthesia is used, and patients don't need to, they can go back without any dressing or any bandage on the eye, and they can almost see well, as you'll be able to see right after the surgery. They're able to see quite well. Now, as this is just today's recording, and we'll just go to the actual procedure. Now, we did two patients. One was a gentleman and one was this lady. I'll just show you both the surgeries very quickly. Now, here we are putting this topical anesthesia. The eye drops have been put. The patient is lying on the laser suite and is ready for the surgery. We just have to fix in a speculum and keep the eye open. Not even any draping or anything is required, because this part of the procedure doesn't have any incisions. When the laser procedure is done, no incisions are made on the eye, so the area remains absolutely sterile. This is a laser machine which is docked onto the eye of the patient. As you will see now, we have prepared for the surgery. And this is the expensive part, because of which the laser surgery is so expensive. This small blue device which I am fixing onto the laser is the main thing. It is known as the interface, which is patient interface. This itself is probably the most expensive part. It costs almost 25,000-30,000 rupees. It's a disposable piece, and it is used for the surgical procedure to dock onto the patient's eye. And here you can see that the patient interface is docked onto the patient's eye, and now this is going to touch the patient's eye with a thin contact lens in between, so it doesn't disturb the patient at all. And once this part has been achieved, then I've cut short some steps of the procedure for the sake of leaving things simple. But as you could see that there are two big screens. One is on the right and the small screen on the left. Now this is the new thing which has come in on the laser surgery in the last 2-3 months itself, which is what Dr. Prakasi was talking about. This is known as a video on image guidance system. This ensures that we are able to perform the surgery fully image guided, so each step is guided. And I won't go into the details, I think they've already explained it, but for this patient we were able to dock the patient and then set all the parameters. I'll run you through it quickly in a few seconds. And as you can see on the right screen now, you'll notice that all these incisions are pre-planned on the Virion system. Here is the Virion system which is doing iris recognition and also the limbal vessels. It tells you that the registration is successful, and it also ensures that we don't have the eye rotated during the surgery so that you have everything right. But once that is done, we are now all set to fire the laser. It takes about 1 to 2 minutes for these steps of the pre-planning before the laser actually fires. And you can customize each step of the procedure. You can see that I'm doing this with the joystick here and the small button, and we are just moving our incisions around that we can plan the surgery in a perfect way, so that now this is the actual procedure when the laser will fire. And once we have done all the planning over here, you'll notice that I didn't have time to edit this video because we did it only in the evening today. But as these steps are being planned, the surgery is basically, now this is the capsule which has been seen under the zoom. This is the anterior capsule of the lens, and then from the lens we will, from the capsule we'll go into the lens itself. This is the lens which is going to be fragmented in this yellow zone. We can set the parameters, the depth at which the laser will fire. Takes a few seconds, then you can plan your incisions. As you'll see here, these are the incisions, this is the cornea. And now once all those things are set, we start firing the laser. You'll notice on this left screen how the laser will start firing now, once all the planning is through. Now we have given the command for the laser to fire from the screen, and as soon as that is done, now the laser is ready, it says, and then you just have to press a foot pedal, and in about 30 seconds the laser will do 80% of the steps of the. So this is the capsular access which has been completed. After this will be the, as soon as the capsule is done, you'll notice the fragmentation of the lens, and this is the lens being emulsified into these, it has been chopped into so many pieces, and this again takes only a few seconds. All these steps we used to do with phaco till now, and now this technology is allowed to do these procedures, and now these are the incisions being made with the laser. This was one incision, this is the second incision, and this is the third incision, and that's complete. So it's just about 30 seconds that the laser actually fires, and then we are through with this part. Then the patient is quickly moved on to the other operating room, and as you can see, this is the image guidance system. This is the actual surgery. I won't show you the details of the surgery, but this is how the patient is lying, and just the last few steps of the procedure are now being performed. And you can see that we take the help of this image guidance system which is on the in front of us, and it can also be seen in the microscope. So this is how it looks on the microscope once the laser was completed and patient comes to the operating room. We open these incisions which have been made by the laser, and you can see how easily these incisions are going to open. And after that, it is these incisions have been opened, and now it's easy to just remove this lens in a few seconds. It requires just about 2 seconds of phaco time sometimes. As you can see, these chops are already made, and these fragments have now been removed. So as you'll see at the end of this procedure, the cataract is completely gone in these few seconds that we took, and after this the lens is implanted as usual. So the lens implantation is almost exactly the same as what we've been doing for the last few years. That step is still to change, and it's still again an evolving technique, but the rest of the steps have shown amazing changes. Now once the surgery is over, the patient will usually just sit up, and no patching is required, no dressing is required. We can just give them these dark glasses and walk them out of the surgery, and in about 5 minutes after this the patient can leave the hospital. This was today's patient that we operated in the morning, and as he walks out, you can see that. And after that, if you record his vision, usually right after the surgery, in about 10 minutes, you can actually make the patient read a few of these lines. I'll just show you how this patient was recorded. We recorded his vision right after that outside, and he was able to read about 5 out of the 7 lines right after the surgery. And of course, you have to take my word for that. Now, these are few of the still images, and I think this kind of conveys the message. I won't want to go into a lot of details, and to to conclude, this is of course the image guidance system which Dr. Pakrasi was talking about just now. We in fact use this in one of the surgeries today also. This is like, I'll just quickly show you that this superimposed green line which is coming is guiding me to make my incisions. For example, I've made one incision here. This is not a femto cataract surgery. It's not a laser assisted surgery, but it's an image guided surgery. This is the other big thing that we are doing now. So these incisions have been made under guidance system of this superimposed grid which is seen on the eye. This also allows us to make the capsular access. So now you can see that it is guiding me how to make the capsular access in a perfect way. So again, while we are not using the laser, but all the steps are guided by this superimposed thing which I can see in the microscope. It shows me each step. Now after that, of course, once these things are done, we can remove the cataract using phaco if we don't want to do the laser. Every patient is not suitable for a laser system. And once that is done, we also do the lens injection under the image guidance system. So you can see that it's telling me how to rotate this lens. This green grid is showing me to place the lens in this particular axis to get the perfect result, and no need for glasses after surgery because this is a toric lens. So as you can see now, the lens is perfectly aligned. These are the marks on the lens, and my image guidance system is showing me that my lens is perfectly placed. So all this has made it possible for us to promise outcomes to the patient where they are relatively free of glasses for about 90% of their activities. The surgery is of course much safer and precise. And I would like to conclude by saying that the femtosecond laser cataract surgery has once again introduced a new technique for the cataract surgeon to learn, pulling them out of their comfort zone or slumber. Last 10-15 years we've been doing our phacos and very happy with our outcomes, but this has again changed the standards for the eye surgeons. It is a rapidly evolving surgery which allows surgery in less than 60 seconds for the laser steps. Of course, the total surgery time may not change, but the time during which the eye is open, or when we are doing the invasive part, is down to just about 2 minutes from the 5 or 6 minutes we used to take. This of course improves the safety standards, and it is now even being used in a lot of the complicated cases with much more safety. So just like all the techniques of cataract still flourish, laser cataract surgery may not replace traditional phaco soon, but will definitely change the standard of care expected by our patients in the near future and even today. And further developments are happening at a rapid pace. Even as we talk, I think every month we are getting new updates, new softwares, new technologies coming in, and I think we have to keep up with these technologies. And with that, I'll finish it. Thank you so much. We'll be happy to take any questions.